Good morning. Today we are going to see about the fibula bone. The term fibula in Latin means thin. So this is the lateral bone of the leg, and then it is homologous with the ulna of the upper limb. So today we are going to see about the ossification centers first. So it's a long bone. So the primary ossification centers for the fibula appears in the middle of the shaft, okay, at around 8 weeks of intrauterine life. Whereas the secondary centers for the upper end appears at around 3 to 4 years of age, and then it unites with the diaphysis at around 18 years. Whereas for the lower end, the secondary ossification center appears at around 1 to 2 years of age and unites with the diaphysis at around 16 years of age. Okay. Actually, the lower end of fibula, it violates the law of union of epiphysis. The law states that the secondary center which appears first has to unite last. It is violated by the lower end of fibula. That is, here the ossification centers appears first at around 1 to 2 years of age, but it unites with the shaft earlier at around 16 years. Whereas for the upper end, the secondary centers appears only at the 3 to 4 years of age, but it unites late at around 18 years of age. And then this violation is because the lower end of fibula is an example for pressure epiphysis, whereas the upper end of fibula, it is an example for traction epiphysis. And also the upper end is the growing end of the fibula, as it is evidenced by the nutrient foramen, the direction of the nutrient foramen. Okay. Now we are going to see about the muscle attachment. This is a thin bone. It does not take part in the transmission of body weight, but it provides muscle attachment, important muscle attachment of the leg. And also it supports the talus along with the tibia. That is, along with the tibia, the fibula forms the tibiofibular mortise, which is going to support the talus bone. Okay. Now we'll start with the upper end of fibula. The upper end of fibula has an oval facet superiorly. How to identify the site of the fibula? There are some anatomical orientation and then site determination to identify the site of the fibula. That is, in the upper end you have the oval facet. Lateral to the oval facet you have a projection called a styloid process. And then in the lower end there is a triangular facet. In the lower end there is a triangular facet which is going to articulate with the talus bone that appears medially. And then below and behind the triangular facet you have a depression called as malleolar fossa. So the malleolar fossa lies below and behind the triangular facet. The triangular facet is medial, and in the upper end the styloid process lies lateral to the oval facet, and then the oval facet is superior. With this orientation, when you hold the fibula bone, this is the left side fibula. Okay. Now in the upper end, this oval facet has to articulate with the lateral condyle of tibia to form the tibiofibular joint. And then the styloid process. In front of the styloid process, you have a sloping area which provides attachment to the tendon of biceps femoris. And then now you have a depression, that is called as compression below the head. So this part of the upper end of fibula is called as neck of fibula. This is head of fibula and this is neck of fibula. What is the importance of neck of fibula? The neck of fibula is related laterally to the common peroneal nerve, whereas medially it is related to anterior tibial vessels. That is, in case of any fractures related to the neck of fibula is going to damage common peroneal nerve and then anterior tibial vessels. The most commonly the common peroneal nerve, it will wind around the neck of fibula. Okay. And then coming to the shaft of fibula. The shaft of fibula, the borders, the surfaces are very irregular. They are not defined, but it is easy to understand. Okay. There are 3 borders and then 3 surfaces in the fibula. One is anterior border. You have an anterior border, that is the sharp border. And then there is a medial border, and then you have a posterior border. 3 borders: anterior border, medial border, and then posterior border. There are 3 surfaces: medial surface, lateral surface, and then posterior surface. Okay. So the medial border is also called as interosseous border, which provides attachment to the interosseous membrane. The interosseous membrane is the membrane between the fibula and the tibia. It provides attachment to interosseous membrane. It provides attachment to the entire length, but where in the upper end alone, there is a deficit. Okay, there is a deficit. There is a gap in the interosseous membrane which provides passage for the anterior tibial vessels. Okay. Coming to the anterior border, the anterior border, when you trace downwards, it will divide in a triangular area. There is an anterior margin for the anterior border and there is a posterior margin for the anterior border. The anterior margin provides attachment to the superior extensor retinaculum, whereas the posterior margin provides attachment to the superior peroneal retinaculum. Okay. And coming to the posterior border, the posterior border, it gives attachment to the posterior intermuscular septum. The posterior border gives attachment to posterior intermuscular septum. The anterior border gives attachment to anterior intermuscular septum. The medial border gives attachment to the interosseous membrane. So coming to the surfaces. Okay. Now you have a medial surface, lateral surface and posterior surface. Muscles related to the lateral surface. The lateral compartment of leg is also called as peroneal compartment, which has two muscles. One is peroneus longus, another is peroneus brevis. The peroneus longus takes origin from the upper 1/3 of the lateral surface of fibula, whereas the peroneus brevis is attached to middle 1/3 and also to the lower 1/3 of the lateral surface of fibula. And coming to the posterior surface. The posterior surface in the upper part, it is divided into a medial and the lateral part by a median crest. Medial to the median crest, it provides attachment to the soleus in the upper part, whereas lateral to the median crest, it provides attachment to tibialis posterior. And then in the lowermost part of the posterior surface, it provides attachment to flexor hallucis longus. Three muscles, soleus, tibialis posterior and then flexor hallucis longus. All these three muscles belongs to the flexor compartment, otherwise called as posterior compartment of the leg. Coming to the medial surface. The medial surface provides attachment to anterior compartment of leg muscles, that is the extensor digitorum longus. It takes origin from the upper part of the medial surface, and then below the attachment of extensor digitorum longus, you have the attachment of extensor hallucis longus, and then in the extreme lower end, it provides attachment to the peroneus tertius. Extensor digitorum longus, extensor hallucis longus, peroneus tertius. All these three muscles belong to anterior compartment of leg. Now coming to the lower end of fibula. The lower end of fibula has four surfaces: anterior surface, posterior surface, medial surface and then lateral surface. Okay, the lateral surface is subcutaneous, does not provide any attachment to muscles or ligaments, whereas the medial surface provides a triangular facet. The triangular facet, as I said earlier, it articulates with the triangular facet present in the talus. So this will articulate with the talus bone. And then below the triangular facet, you have a depression. This is called as malleolar fossa. The malleolar fossa provides attachment to posterior tibiofibular ligament and then posterior talofibular ligaments. Coming to the anterior surface. The anterior surface is rough and then it provides attachment to anterior talofibular ligament. And then in the lower part, it provides attachment to calcaneofibular ligament. And then coming to the posterior surface, there is a groove here where it is related to the tendon of peroneus brevis and then peroneus longus. Peroneus brevis is superficial to the peroneus longus tendon here. Nutrient artery of the fibula is a branch of peroneal artery. It enters the nutrient foramen just above the middle of the posterior surface. And then the nutrient canal is directed downwards here. Okay. Fractured fibula is more common along the neck of the fibula and also in the lower part. That is 2 to 5 centimeter above the lateral malleolus, it is more prone for fractures. When there is a fracture in the lower end, it is associated with the dislocation of the ankle joint. Thank you.